Hello, everyone. Welcome to day 28 of the Dr. Joanne Lewis Foundation Heart Disease Awareness. We made it. We have raised awareness all month long of February of heart disease. And today, on our last day, it is a very special day as we wish our Vice President of the Dr. Joanne Lewis Foundation, Renee Richardson Jourdain, a very happy birthday, a very blessed birthday to one of the most beautiful people that I know, which just so happens to be my goddaughter. So today, in light of the fact that our vice president is expecting a little bundle, I decided to do the last episode on pregnancy and heart disease. And don't worry, Renee, this is not about you because your heart is fine. We made sure of that. But for those with heart disease, and pregnant, I think that they will find this very helpful. So as we wish you a happy birthday, we just want to raise awareness of pregnancy and heart disease because pregnancy does place major cardiovascular stress on the body. And heart disease is now the leading cause of pregnancy-related deaths in the U.S. Most people with heart conditions can still have healthy pregnancies, but the risk prevention strategies and management approaches vary widely depending on your underlying condition. So, pregnancy increases blood volume by 40 to 45%. It increases heart rate by 10 to 20 beats per minute and cardiac output by 30 to 50%. These normal changes can unmask or worsen heart disease, and they overlap with symptoms of cardiac problems like fatigue, shortness of breath, and palpitations, making the diagnosis harder. So there are some risks to the mother. In heart failure, especially cardiomyopathy or significant valve disease, arrhythmias, common in congenital heart disease and cardiomyopathy, aortic dissection, particularly in Marfan syndrome, Loeys-Dietz, or aortic dilation. Nearly half of dissections in women less than 40 occur during pregnancy. Stroke or blood clots, especially with mechanical valves or atrial fibrillation. Hypertensive disorders like preeclampsia, gestational hypertension, which increase long-term cardiovascular risk. Maternal mortality. Cardiovascular disease accounts for about 1/3 of pregnancy-related deaths in the U.S. So there are some risks to the baby. There's preterm birth, low birth weight, fetal growth restriction, congenital heart disease if the parent has CHD, or stillbirth and severe maternal disease. So some heart conditions are relatively safe. Others require intensive monitoring or may make pregnancy unsafe. So there are high-risk conditions which include cardiomyopathy, especially dilated, up to 40% risk of heart failure, severe valve stenosis, mitral or aortic, mechanical heart valve due to clotting risk and anticoagulation challenges, pulmonary hypertension, extremely high maternal mortality, and aortic disease like I said, and Loeys-Dietz, bicuspid aortic valve with dilation. There are lower risk conditions which include mild congenital defects and repaired congenital defects with normal function. So prevention, reducing risk before and during pregnancy. So pre-pregnancy planning, cardiology evaluation to assess risk and optimize treatment, medication review, like some drugs like ACE inhibitors, ARBs, statins, certain antiarrhythmics must be stopped before conception, imaging that are needed, echo, MRI, to assess heart function and aortic size, genetic counseling for inherited conditions, contraception planning until the heart is stable. So the European Society of Cardiology and ACOG both emphasize pre-pregnancy counseling as a cornerstone of safe pregnancy. So there are some risk factor prevention during pregnancy, like controlling blood pressure, because chronic hypertension has doubled in recent years and is a major driver of complications. Manage diabetes. Strict glucose control reduces congenital heart defects and preeclampsia risk. Maintain healthy weight. Obesity increases risk of preeclampsia, gestational diabetes, and long-term heart disease. Avoid smoking, vaping, which are linked to preterm births and low birth weight, and treat sleep apnea. There are some long-term preventions because pregnancy complications like preeclampsia, gestational diabetes, and preterm birth are red flags for future heart disease. Postpartum cardiovascular follow-up is essential. And during the pregnancy, you need care by a cardiothoracic obstetric team based on modern guidelines. You need monitoring like frequent echoes, rhythm monitoring, aortic imaging, and blood pressure monitoring, medication management. So some general principles, but you need individualized instructions from your primary and or cardio obstetrics. Many beta blockers, labetalol, nifedipine, methodopa, are commonly used for hypertension, and some ACE inhibitors, ARB, statins, and some antiarrhythmics are avoided. Anticoagulation for mechanical valves is complex. So for delivery planning, vaginal delivery is preferred for most with careful monitoring. C-section is reserved for specific cardiac indications. And there's also some anesthesia planning. Postpartum care period carries the highest risk of heart failure, arrhythmias, and aortic complications. So I wanted to review all this because I am expecting my great grandchild, and I know that some pregnant women have concerns, especially if they have heart-related issues. I pray that everyone has safe pregnancies and no heart disease, especially if you take care of yourself, if you eat right, if you don't smoke and avoid certain toxins. So this concludes our heart disease awareness. This concludes day 28, and I wish a very happy birthday to Renee Richardson Jorday, and may your day be blessed, may your life be blessed, may your baby be blessed, may your marriage be blessed. We pray for you. We keep you in our thoughts and our prayer. We love you so, so much, and I hope everyone enjoyed and got a little bit of tidbit from our heart disease awareness session at the Dr. Joanne Lewis Foundation. Tune in the second Tuesday in March as Kimberly Demostine presents on kidney issues. So take care, everyone. Love you, and thank you for joining us for Heart Disease Awareness. Love you. Mwah.